Ladies and gentlemen, it's with great pleasure that we are having season 3.5. Uh, Season 4 will be after 14th of November. So this is season 3.5. This is the Department of Maxillofacial Surgery and the CIMS, which is holding this webinar jointly. So it gives me great pleasure to have our alumni who are going great guns in all the specialties of maxillofacial, subspecialties of maxillofacial surgery. And today we have one of our charismatic speakers and clinician, Dr. Sapna, and our alumni from the second batch, Dr. Nilima, who would be presenting and moderating this session today. So I would, it's actually a great pleasure for me that, we have our alumni to speak on various topics. We've done that before, and now we are having it yet again. Dr. Nilima, who is from the second batch, is one of the very illustrious postgraduates and oral and maxillofacial surgeons in the city. And she has many publications and accolades to her credit. She has also been a topper in the MBA exam in healthcare management by the Nagpur University about 4 years back, and she is reputed for her managerial skills in the department. She's also got many publications. She's got an electronic book in her name, and well, she's there everywhere whenever you need her. So I would now like to present Nima, who's going to moderate the session and to conduct the proceedings from here on. Before Nilima starts, I would like to welcome Garg sir, who's here. Thank you, sir.
Good morning, everyone.
Nice to see
Good morning,
you.
sir.
Good morning,
sir. Good morning.
Nice to see you all.
Sir, thank you for joining. And Nilima, please go ahead.
Yes, sir. Yes.
Yeah, Nilima.
Thank you, Shinoy, sir, for those nice words.
Nilima, just one more minute.
And thank you for giving me this opportunity. Yes, sir.
Nilima, just 1 minute. I would like to welcome.
Yes.
Welcome our Secretary of CIMS, Dr. Varsha Manekar, who is in GDC right now, who recuperated after a minor illness, and Dr. Vrinda Kulte, who is the treasurer, as well as she's a professor in the department. Sorry, Nilima, for interrupting. It's an old habit of mine. Please go ahead.
No, sir. Yes, sir. Good morning, everyone. It's my privilege to introduce our very own student, Dr. Sapna Vadera, who is doing a very good work in the field of aesthetics. She has done her graduation from Datta Meghe Institute of Medical Sciences and post-graduation from VSPM Dental College. She holds a fellowship in rhinoplasty and facial plastic surgery from Indian Society of Facial Plastic and Reconstructive Surgery. She pursued her advanced fellowship in facial plastic surgery and facial cosmetic surgery from the Aesthetic Clinics Mumbai, where she is currently attached as a consultant also. She has numerous publications to her credit and is co-author in various textbooks as well. She has been awarded for excellence in facial cosmetics at Indian Health Professional Awards in 2019. She has also been awarded with Youth Icon of the Year and Youth Achiever, Young Achiever in Facial Cosmetics by IADS in 2020. She was one of the youngest keynote speaker at 44th National AMSI Conference held in Bangalore. Recently, she presented 6 scientific papers at American Academy of Cosmetic Surgery in Las Vegas. She is also a member of Institutional Ethical Committee at the Aesthetic Clinics, India's only private organization which is DCGI certified to conduct clinical trials in cosmetic surgery. At this young age, the list of her achievement is long, and Dr. Sapna, we are really proud of it. And I now request you to kindly start with your presentation. Thank you.
Thank you so much, Dr. Pleasure to
be speaking at my own college. And thank you, Dr. Shinoy sir, for giving me this opportunity, for the endless support always. Also, I would like to greet Dr. Anup Garg sir, Dr. Brinda Kolte ma'am, and all the senior faculties present here today to listen my presentation. Thank you so much. It means a lot to me. So, and thank you, ma'am, for the lovely introduction. So I would like to start my topic with the fact that transformation is a very common thing and is very natural, and we see transformation everywhere. We see transformation in a good sense when we talk about face. We have witnessed everyday life. We witness beautiful transformations, and we witness ugly transformations. So a difference between a very beautiful transformation and ugly transformation is what we call as the art of facial contouring. And that is what I'm going to talk about today. So I am Dr. Sapna Vadera. I am a facial plastic and facial cosmetic surgeon based in Mumbai. I am attached to a center, Pan-India Cosmetic Clinic Center known as the Aesthetic Clinics, Mumbai. So we have multiple centers all over Mumbai and all over India. Apart from Mumbai, we have multiple centers in India. A basic introduction, I have done my graduation from Datta Institute of Medical Sciences, Wardha. My post-graduation from VSPM's Dental College, Nagpur, under Dr. Shinoy sir. And I have done my fellowship in rhinoplasty and facial plastic surgery, and my advanced fellowship in facial plastics and facial cosmetic surgery from the Aesthetic Clinics, Mumbai, where I am currently attached as a consultant. So as I mentioned earlier, we have multiple centers and tie-ups all over Mumbai with some of the best hospitals in India, including Breach Candy, Saifi, Fortis, and Apollo Spectra, to name a few. So what I'll be talking today would be about aging, because that's how everything starts, about the rejuvenation procedure. The second would be anti-aging protocol, how to go about it. Moving on to the treatment modalities, how we do the anti-aging procedures, including facelifting devices, facial threads, botulinum toxin, dermal fillers, and deoxycholic acid. I will be dealing with them individually. Then the methods, about each product and about each technique. And after that, I'll be talking briefly about recent advances in the hair rejuvenation, non-surgical hair rejuvenation. And then I would finally conclude it. So to begin with, as we know, aging is a continuous process, and we see aging with very early stages of life. The signs of aging starts. There are two types of aging. There are two things which leads to aging: intrinsic factors and the extrinsic factors. The intrinsic factors basically includes the hormonal profile, the genetics of an individual, which leads to deep changes in the skin, the changes in the deeper layer of the skins, in the dermis. It causes the three-dimensional detachment of the elastin fibers, collagen fibers, facial fat atrophy, etc. All these changes leads to skin atrophy, dryness, loss of elasticity, wrinkles, fat atrophy, muscle atrophy, bone resorption, sagging, folds, etc. The second type of aging is the photoaging or the extrinsic aging, which is of course because of the extrinsic factors like the damage due to UV radiation, etc. So this causes superficial changes in the skin, in the superficial layer of the skin. So the changes which appear are in the form of, I'm sorry for this. The changes which appear are in the form of pigmentation, fine wrinkles, and loss of elasticity of the skin. So as I mentioned that as we age, there are three factors which significantly contribute towards the aging. They are the changes in the bone compartment, which affects the aging process, the facial fat compartments, and the collagen and the elastin fibers of the skin. The facial fat compartment is what we are going to deal with, because that is what we do in rejuvenation. So when there is the aging of facial fat compartment, there is loss of the structure of the superficial and the deep fat compartment. The separation and loss of support leads to all the signs of aging. There is separation of the malar fat pad, drooping of the malar fat pad, leading to the formation of jowls and leading to the formation of nasolabial fold. And there is loss of the fat pad around and below the eye, leading to the signs of aging around the eye, like under eye dark circles and under eye loss of volume, etc. So when we talk about aging, usually, and when we talk about the anti-aging protocol, what comes in our mind usually, and a picture which we see ourselves is about the Caucasians aging, how Caucasians age and how the treatment protocols are being demonstrated on them, or how we see the publications which are based on a Caucasian face. But that is not how an Indian face ages. Aging of Indians is very different from the Western world. So to go about the protocols based on how they are done in the Caucasians is not justified, and it doesn't actually apply. To overcome this, we studied Indian population, we studied how Indian people age differently. And these are few of the pictures of our case study. And what we see is, this is a typical example of how an Indian face ages. If you see a young face, which would be typically oval in shape, gradually over the period of time, there is increase in volume in the lower half of the face, in the neck area, causing the face to become more and more round over the period of time. There is development of bulk in the lower half of the face. This is very different from the Caucasian people, where there is loss of the entire volume and there is more sagging of the face. And compared to that, Indian face becomes bulkier with time. And we came up with our study, which has been published in the top American Journal of Plastics and Reconstructive Surgery, about aging of Indian face. What we noticed is that a young face, which is usually oval, this is an example from the study, usually gains volume in the chin region. If you see, the double chin starts appearing at the age of 40 years, and the face becomes more and more round and more round over the period of time. So when the aging of Indians is different from Caucasians, the anti-aging protocols of Indians has to differ from that of Caucasians. That we concluded from the study. So a typical Caucasian face would droop down over the period of time. That's why what they do is they do a lot of facelifting procedures, and they do a lot of fillers. But that is required in Indian face to a lesser extent, because Indian face already gets bulkier over the period of time. So we cannot just stuff the face with fillers depending on how Caucasians do it. So what I'm going to talk about is how we can rejuvenate an Indian face. So if aging is everything coming downward, inwards, and medially, anti-aging should be taking everything upwards, backwards, and laterally. There are certain parameters which we need to follow. Before I start and talk about the anti-aging procedures, there are certain things, certain aspects which we need to keep in mind, that what we have to achieve. First and foremost is symmetry. This is a universal law that the substance which is symmetrical would look beautiful. But having said that, also asymmetry to a certain extent is natural. It's obvious, and it has to be there. It is there. So, but as we see, all the objects are usually symmetrical. But even if we see the most beautiful and most groomed faces also, they are a little bit asymmetrical, and the right half of the face is not 100% symmetrical to left half of the face, and we have to respect this, and that 100% cannot be achieved. But yes, we should try and bring as much as symmetry to a face as possible. The second is golden ratio. So a Greek mathematician known as Fibonacci devised and introduced this ratio called as the golden ratio, which says that the length of the face should be 1.618 times the bizygomatic width of the face. And anything, any beautiful structure you see in the world, be it the pyramids, the Alps, the DNA molecule, flower petal, any beautiful structure follows this golden ratio. And therefore, a beautiful face also must follow this golden ratio. So, a physician known as Stephen Marquardt designed a mask based on this golden ratio. And if we see carefully, any beautiful face fits very well within this mask. This defines beauty. Whenever we try and if we get a patient and we try and put the face or try and modify the face as per the golden ratio, it is bound to look beautiful. That's what the mask suggests. The next point, which is very critical in the restoration or rejuvenation of a face, is the Og's curve. Og's curve is the curvilinear structure, a curvilinear line which defines the side profile of the face. So it is basically formed by the malar eminence. So redefining and defining the malar eminence is a key structure to restoring a beautiful face. So usually we don't seem to care much about the Og's curve, and we think that it won't affect the beauty of the face. But it clearly defines the upper half of the face. It clearly gives a very beautiful outlook to the side profile of the face, which is very important for the people who are coming for cosmetic rejuvenation, because they are usually in the profession where they want to look beautiful. And for example, there are a lot of models or a lot of celebrities or high profile people also who come for a cosmetic rejuvenation, and what they want is their face should look beautiful on side profile maybe. So it gives, Og's curve gives a very good definition, and it's mostly because of the malar eminence. It gives a very striking appearance to the face. So as I said, it might not seem that it is that important, but when the Og's curve is not restored properly, it gives a very puffy appearance to the face. As you can see in this picture, when the Og's curve is not restored, the face looks very bulky and very puffy. So yeah, defining this part is it's very important. As I said, it gives a very striking appearance. A beautifully defined Og's curve gives a very striking appearance to the face. Other important factors are the facial angles, including the nasofrontal angles, the cervicomental angles, etc. So defining these angles also increases and highlights the beauty of the face. So these are the basic anti-aging factors which we need to keep in mind before we jump into doing any procedure like Botox or filler or anything. We have to see the patient, we have to examine what all things are not within the confines which defines the beauty of the face, and then try and modify those things. So the techniques, what I'm going to talk about is the facelifting procedure, non-surgical facelifting procedure, because the presentation is about the non-surgical things. Then the facial threads, botulinum toxin, dermal fillers, and deoxycholic acid. Starting the facelifting devices, there are numerous facelifting devices which are available in India with different names, including HIFU, Ultra, Althera, etc. So I am going to talk about how we can choose a face which needs facelifting, and how we can differentiate that which face would need facelifting, which face would need facial threads, because facial threads are also used for facelifting. Usually all the faces which are bulky and which are drooping are good for facelifting procedures, because what happens is the energy which we use in facelifting procedure, non-surgical facelift, is the ultrasonic energy. What this ultrasonic energy does, it causes a three-dimensional mesh formation in the collagen structure which is beneath the skin. If we use it in a thin face or a narrow face, it is further going to make the face more narrow, and the face would not look very good, because it will look very thinned out. So a thin face person is not an ideal candidate for a facelifting procedure. Even if they come to you saying that they have heard somewhere that they want to undergo a face lifting procedure, it is your duty to make them understand what would look good on their face and what would not look good on their face. So a bulky drooping face is a good candidate for facelifting, face tightening procedure using ultrasonic facelifting device. Also, why we cannot do threads in them is threads won't retain the bulk of the face. So doing a non-surgical facelift using a device would be better in a bulky face, and doing facial thread lifting in a thinner drooping face would be a good choice. So what I'm going to talk about here is a machine which we have in our center known as Altherapy or Althera. So what it does is, as I already said, that it causes when we use the probe or the transducer, it delivers the energy to the skin, to the deeper layer of the skin, and we can calibrate the energy. We can decide the depth, what depth we want the energy, 3 mm, 4.5 mm. There are multiple, there are different transducers which are available with the device. And it delivers ultrasonic energy, so we have to follow certain rules, certain lines and configurations in which the device should go. I have demonstrated it later. And we form a three-dimensional mesh, and over the period of time there is binding of the collagen around the mesh which we have laid down, and it causes tightening and lifting of the skin. So immediate result is seen within one, like after the procedure, 30 to 40%, 50% result is visible. And over the period of 2 to 3 months, the results goes on improving. So this is the device, and this is how the areas can be marked. This defines that the area, that how we mark the area, and these are the numbers that how many how many times we want to introduce the energy to that part. These are the directions in which we can move the transducer. As I said, this is how we mark it on the patient's face. This is the example. The numbers here depicts the number of times we are introducing, giving the energy. We call it shots. So how many times we are giving the shots of the transducer, we can define this area. At a time, around 800 shots in total can be given to a patient. Usually for a moderate drooping face or moderate face lifting, we usually do around 500 to 600 lines. And we divide it in the area depending on what area needs how much of lifting. This is how we hold the probe, the transducer, and the switch, and this is how we do. So we don't need to take the patient into a general surgical procedure or something. We can do it in our clinic. It's a clinic-based procedure. 1 hour, one and a half hour, it would hardly take. Slight amount of pricking sensation few patients may feel, so we can give them either local topical anesthesia we can apply beforehand, or we can give them a painkiller and they would be very much comfortable with the procedure. This is how we move the probe. Towards the upward, in the upward direction, and depending on the direction we want lifting. Usually for the neck we can go like this. So these are few of the patients which we have done. So we have a lot of patients coming from overseas also. So these are few of the examples which we have done at our center. The lifting which we can see 1 month post procedure results. This is also female in which there was a significant amount of lifting which was required in the lower half of the face. So this is the first study from India which we have published for the non-surgical face lifting procedure using ultrasonic device on Indian population, and the results are very good with this device, with least amount of adverse effects or side effects. So the only care and post-operative care would be, we have to keep the device away from the lower border around the marginal mandibular nerve. We have to keep it away from that. Local anesthesia, as I said, might be required. Minimum sun exposure post the procedure, or else it may cause rashes, etc. in the patient. No icing, because this is a heat energy which we are giving, and we don't want any icing over it post the procedure. And no other procedures to be done for 2 weeks, as the patient might be a little sensitive for 1 to 2 weeks. The next would be facial threads. So there are multiple types of threads which are available: PDO threads, Aptos threads, and plain threads, cogged threads, then one-sided, two-sided. There are a huge variety of threads which we can choose from, and also the width, the gauge of the threads is available, so that we can decide how much of lifting we want, and based on that we can choose a thicker thread or a thinner thread, etc. Like for example, in forehead we require usually thinner threads. What all places we can do thread lifting? We can do it for forehead, we can do it for malar area, we can do it for nasolabial fold, which is most usually done. We can do it for jaw lifting, chin lifting, and for the submental folds, etc. So this is the patient which we have done using thread lifting. As I said, that thread works beautifully on thinner faces. They do work on thick faces also, but combined with other procedure. For example, if we do a face lifting device procedure once, and then maybe the residual lifting, if at all is required, we can cover it with threads. That would be a good idea. But entirely supporting a thicker, wider, bulkier face with threads won't do a very good job. Also, it's very, very important to understand that how we are doing the procedure. Understanding the crucial, that is a very crucial part. There might be few complications with thread, like slight amount of abscess may form, or there might be some poking of the thread, or puckering of the skin may occur. So over the period of time, I think you can overcome all these things, and you can learn from your own experience that how not to get into such complications. If there is, in case some thread is pulling out, or bit of the thread is coming out, you can simply cut it with scissor, etc. Next is the botulinum toxin. So this is a very important part, understanding the toxin. It basically comes from Clostridium botulinum. 7 serotypes are available ranging from A to G, but what we usually use and what is commercially available for cosmetic purposes, botulinum toxin A and B. In India currently, 3 types of toxins are available, which are Ona botulinum toxin from Allergan. So this one is usually called as Botox, and it is so famous that nowadays people have stopped calling botulinum toxin, and they call it just Botox. But Botox is actually just one product which is from Allergan. Otherwise, the actual name is botulinum toxin only. So the botulinum toxin available by Merz is Xeomin, and the third one is Ciex. So these are 3 popular toxins which are being used, and I have personally used 3 of them, and they are very good. All 3 of them gives good results. So the basic mechanism of botulinum toxins, mechanism of action would be, it usually interferes with the formation of a snare protein complex which fuses with the neuromuscular junction and releases the neurotransmitter acetylcholine. So it usually interferes with this complex formation, and that's why the neurotransmitter cannot be released, and as a result of that, the contraction is hampered. The mechanism is temporary, and over the period of time, more neurotransmitter is formed, and therefore the function is restored after 3, 4, 5 months, depending on the patient. Usually 4 to 6 months is considered an average action of botulinum toxin. Very important, before jumping and before doing the patient, understanding the basic anatomy of the facial structure is very important. Understanding individual function of each and every muscle is very important. Understanding that if you are injecting in the crow's feet area, it should be given as superficial injection or a deep injection. If you are injecting in corrugator muscle, it is a deep or superficial injection. What areas to be injected, what areas to be left, depends on how good is your facial muscular anatomy. So learning the anatomy is the key to giving botulinum toxin injections. How it is prepared? So basically it is freshly prepared. What we do is basic armamentarium that is required is the botulinum toxin vial, which comes as a 100 unit usually vial. I'll be talking about a 100 unit vial here. And we need a syringe, a 0.9 ml normal saline, and insulin syringe, which we usually use for the injection. So here's a short video demonstrating how to mix botulinum toxin.
The materials required are.
So we need a bacteriostatic 0.9 ml sodium chloride, that is normal saline. If that is not available, A regular normal saline can also be used, which we usually also used at our center, because what happens is not always 0.9% is available. It is recommended because it very well falls within the pH and maintains the pH very well. So what we do is take 2.5 ml of normal saline to be mixed in 100 units of botulinum toxin. So we get 4 units per 0.1 ml of solution. So now as we withdraw the saline, I'll come to the important part. So now that we have taken the saline, we have to make sure there are no air bubbles, because vacuum has to be maintained inside the vial. Now the most important part comes is when we put the saline in the botulinum toxin vial, which is in the form of powder. If you'll see when we open the bottle, we have to slowly put the solution, the saline inside the botulinum toxin vial, because we don't want any kind of pressure, high pressure, because the solution, the product might get like this. So what is important here is no vigorous forcing the saline inside the bottle, because the molecules, the botulinum toxin molecules are very fragile. So if we apply a lot of pressure while putting the saline in the solution, while putting the saline in the bottle, or while mixing, so the this can get disrupted, the product can get disrupted, and the action won't be so good. So everything has to be done very quietly and without any vigorous movement. While mixing also, it has to be gently mixed. Vacuum has to be very nicely maintained if in case we want to store the solution, because not everyone would use all the 100 units at the same time, especially those who are starting with their practice. They won't be using, because we don't usually use 100 units on one patient. So in case you'd want to store the Botox or you wanted to maintain, then all these steps are very crucial that we have to maintain the vacuum. And once the amount of Botox which we have withdrawn, we can tightly seal it with a micropore or a cotton, and then with a micropore, so that a vacuum environment is maintained, and then we have to refrigerate it again. So once we have mixed the solution, we withdraw it in a syringe. Insulin syringe is usually preferred. We have to make sure there are no air bubbles. Sorry for the interruption.
What happened, Sapna?
I think there's some interruption in my presentation. Just a second, sorry for the glitch.
Are there any questions, Nilima? You're muted, Nili.
Yeah, so shall we take it now or later?
Okay, is my screen visible?
No.
Just a second.
No, we can't see your screen. We can
Just a
see you, not the screen. How are you, Garg, sir?
Is it visible now?
Yeah.
Yeah, yeah, now it's visible.
Okay.
Yeah, please
As I
continue.
was saying that what we can do is usually it comes in a 100 unit vial or a 50 unit vial. So if we consider a 100 unit vial, there can be different concentrations in which we can mix the saline in the botulinum toxin depending on the strength what we want. You can take the screenshots if you want to note down the calibrations. We can mix it in 1 ml of saline with 100 units of botulinum toxin giving 10 units per 0.1 ml. We can also mix it in 2 ml of saline with 100 units of botulinum toxin giving 5 units per 0.1 ml, or we can mix it in 2.5 ml, which we usually do, giving 4 units per 0.1 ml. So when we take this in a insulin syringe, which is of 1 ml strength, what we get is we get 4 units per 0.1 ml, and we can very well see this here also. So in total we get 40 units in this syringe, and this on the other side of the syringe also depicts the units. So either we can inject it in the form of how many ml we are injecting in the patient, and we can also keep a count of how many units we are injecting in the patient. So it becomes very easy. Important points with respect to botulinum toxin, as I said, for anyone to to use botulinum toxin, there's some disturbance from somewhere.
একটা পেশেন্ট আইবো এইটা প্রীতমের বউ ওই দিনকে যাইছিল
Just a second. Unmute.
So it's very
কালকে
important
আপনার কথা ছিল
to consider that a normal allergen botulinum toxin would cost you 18 to 20,000 for 100 units. A cold chain has to be maintained because otherwise the longevity, the shelf life of the toxin is not maintained. Gentle reconstitution, as I said, no vigorous shaking. It has to be stored at 2 to 8 degrees. Although the literature says it has to be freshly prepared and you cannot store it, but we have used, and there are multiple publications also from our end where we have stored it, and the efficiency of the toxin remains maintained for 4 to 6 weeks if properly stored. And as I said, the point of injection is very crucial. So some of the cases where we usually use botulinum toxin for facial rejuvenation includes the glabellar line, where we inject, which are formed because of corrugator supercilii and procerus muscles. So there is no fixed point that it has to be injected here only. It all depends on wrinkle, that where are you able to appreciate the wrinkle, and based on that the points can be calibrated and the areas can be marked accordingly. The next would be forehead lines. So when we inject in the forehead lines, we have to keep in mind, for example, as I said, the basic rule that we have to keep in mind the anatomy. Forehead lines we are injecting in frontalis muscle. Frontalis is the only brow elevator. So we have to be very careful not to inject in the lower half of the forehead. If we do so, we would lose the elevation action of the frontalis, and it can lead to brow ptosis. So you have to always keep in mind that it has to be in the upper half of the forehead for the treatment of wrinkles. Then moving on to the brow lift. When we want the brow lift, we give it in the orbicularis oculi muscle in the lateral half. So what it causes is the drooping action is reduced and the frontalis takes over the elevation action, and it causes the lateral brow lift. So this is how we mark and calibrate the points for the botulinum toxin injections. 2 to 4 units on each point is sufficient. I forgot to mention, usually the points which we have marked, we usually inject 2 units in each point. And one more thing important is that all the points should be at a distance of approximately 1 centimeter, because that is the range of action of botulinum toxin. And crow's feet also, as I said, that depending on where the wrinkles are available, where the skin folds are available, we can calibrate our markings and our injection points. For drooping corner of mouth, the depressor anguli oris muscle has to be deactivated using botulinum toxins, and this is the injection point for that. So we usually use of botulinum toxin for cosmetic purpose is usually for the upper half of the face and less for the lower half of the face, specific to few important indications. So as I said, for the drooping, we inject on the depressor anguli oris. Few injection point, a slight amount of injection can also be given to release the platysma action causing the drooping. For gummy smile, it occurs because of 4 muscles. So when a patient comes for a botulinum toxin for gummy smile, we have to make sure that it is because of the muscular action and not anatomical, skeletal, or because of the gingiva, more gingival display. So if and only if it's because of musculature, then only botulinum toxin would be advisable and useful. So it basically occurs because of 4 muscles, that is levator anguli oris, levator anguli oris alecunese, and zygomaticus major and minor. So all these 4 muscles are injected using botulinum toxin for the gummy smile. One more cosmetic use of botulinum toxin is for the Nefertiti lift. So Nefertiti was a queen from Egypt, she was a global icon for beauty and facial beauty. So a prominent feature of her face was a very slender and high long neck. That's how this lift has come to has got its name. It's called a Nefertiti lift. So it's basically the lines over the neck are formed because of the action of contraction of platysma over the period of time. And as I said, that wherever we can feel the bulk, or we can feel that their action is more, or the bands are visible, we can use botulinum toxin in a calibrated manner. Certain complications from the botulinum toxin includes brotosis. As I said, it occurs if too much of frontalis is action is hampered. Litosis can occur if levator palpebrae superioris muscle is inadvertently injected by botulinum toxin. Brow elevation like this can occur if we confine our injection only to the medial half of the forehead, and the lateral half of the forehead is not injected. Then this kind of brow lifting, brow elevation can occur, which is usually called as a Mephisto sign, or Mephisto is a comic devil character, so it's famous from its name. And this can be corrected by properly calibrating the Botox in the required manner. Again, medial ptosis, medial squint can occur if we inject if we give a deep injection in the crow's feet area. More superficial injection is required here. So if a deep injection is given, it can paralyze the lateral rectus muscle, causing a medial squint. The next most important use for botulinum toxin is for a bulky face. Now we know about the bulky face, that a bulky face, the treatments which are used, which are still popular these days, are the removal of buccal fat pad and cutting of the fibers of masseter, or reducing the jaw angle of the mandible, which is usually a Korean procedure done more in Korean population. These procedures are very common, and being a maxillofacial surgeon, we should know all these procedures, how to be done, and which face would be good with which procedure. But not always you will get a face, a person who is in the mid 30s or 40s or 50s who will come for the treatment of bulky face. At times you will also get a very young person, a young girl or a young boy, who has a bulky face and who has a broad masseter or lower half of the face and would want a reduction for that. For example, she came to our clinic, she was 20 something, 25 or something, and she had a very bulky face. She wanted reduction. Now, what we have to keep in mind is, when we go for the procedures like buccal fat pad removal in a young patient, we have to keep in mind that over the period of time, when facial aging occurs, there is always going to be drooping of the facial structure. There is always going to be downward motion, and moreover, when the fat is absent, at that time, this fat is very useful. And if we remove the buccal fat pad, it can give a very unusual hollowing of the face at the later stages of life. So removing fat is also very crucial. Understanding when to remove fat and when not to remove fat is also very important. So in such cases, botulinum toxin works very good for masseter muscle. So we have done a study where we gave botulinum toxin 10 units on both the sides of the masseter. So this also can be calibrated when you feel the bulk, and when you think that the bulk is more on the lower part, you can calibrate and give 5 more units there. That is completely okay. Usually standard protocol, what we follow is 10 units of Botox to be given, botulinum toxin to be given at an interval of 4 weeks. So this procedure has to be repeated 3 to 4 times, and a reduction in the masseter bulk is observed by 40 to 50%. And this is not just for 4 to 5 months as opposed to its action for the fine lines. Here the action is semi-permanent. So we have done a 4-year follow-up study also, and action was retained for a period of 4 years because it causes atrophy of the masseter muscle. So as you can see, this is the result which we have achieved with just 4 sittings of Botox, as I said, injected at an interval of 4 weeks each. Almost 30 to 40%. So she had a very bulky face. So we have almost achieved 30 to 40% result reduction in the bulk of the masseter muscle. So what we again notice here is we are restoring, in one way or the other, we are restoring the golden proportion of the face. As you can see, the length here looks less and the width here looks too much. And as we know, in the golden proportion, the length should be 1.61 times the width. So this width has to be less. So when we reduce the width, the face automatically starts to fall within the golden ratio and starts to look beautiful. Not very beautiful, but falls within somewhere around the structure of beauty. Few more patients done with masseter for botulinum toxin for masseter hypertrophy, and reduction of the bulk of the masseter has been seen. So our study which we did on Indian population, and it works very good. Next use of botulinum toxin is for the scar revision. So what we do is, before we proceed for scar revision, if we inject 20 to 30 units of toxin all around the scar, what it causes, it relaxes the muscle around the scar. And when we do the scar revision, so after the procedure is done, the pulling of the scar is reduced because muscles are in the relaxed state. So when we do this, we have noted that it gives very nice results. One more use of botulinum toxin, what we do is for the blepharospasm. As you can see in this patient, there is a vigorous contraction of the lids. So what we do is we inject botulinum toxin all around the eyes, and a significant result can be seen over the period of time. So this procedure has to be repeated every 3 to 4 to 5 months whenever the patient comes back with the complaint. And over the period of time, the patient adopts it more and the duration increases. So this is how it works. This is how we calibrate the Botox around the eye. And of course, we have to give and we have to see the patient. If at all we see some point it is not working, then we have to recalibrate based on the patient. Next is the dermal fillers. So dermal fillers available in India, mostly there are a lot of companies, lot of fillers available. The most popular ones and the good ones are from Juvederm and Ballotero, that is Merz and Allergan fillers. These are the best fillers which are available. Apart from that, there are a lot of local fillers which are available. So one packet has 2 syringes, 1 ml each. So a total of 2 ml filler is available in 1 syringe. Important points, as I said, is 1 ml. 1 ml would cost you, a good company filler would cost you 15 to 18,000, depending on your dealer, etc. A sterile environment has to be maintained. For example, if you have used half ml of filler in one patient, you usually should not use the same filler in some other patient. You can store it and you can reuse it in the same patient, but avoid using it in the other patient, because what we do is we aspirate a little bit just to check that we are not into the blood vessel, etc. And therefore, we should not use the same filler in some other patient. It can be stored and used later. Point of injection, again, as I said, is very crucial. And the action of filler can be reversed using hyaluronidase. So in case if you feel some places you have filled more, then you can use hyaluronidase and you can, it dissolves the filler basically. So again, understanding, as I said, in Indian face are not meant to be dumped with fillers. We have to be very careful where to use filler, and it should be used in just minimal amount, because gives beautiful result when used in minimal amount. If we keep on stuffing the face, it's not going to look natural. And this is a very good example of how a filler can go bad on an Indian face. So in the under eye area, we have used fillers here. There was a slight amount of hollowness, which was causing dark circles, giving the appearance of dark circles. So we have injected fillers here, and it gives just a fresh, rejuvenated look. The same, there was a slight amount of fat pad which was visible, under eye pad which was visible. So what we do is it causes a mountain and it causes a valley below. So we can either go a fat pad removal procedure, but if you think the poking of fat pad is very minor, what you can do is you can fill the underlying valley and you can mask it and make it even, what we have done here using filler. This is the side profile of the same patient. Again, under eye fillers used for fine lines, etc. Here, what we have done is, as you see, the face looks oval here, round here. We have made it more oval by giving a slight prominence to the chin. So we have defined a jawline, chin using filler, and also we have done slight amount of filler in the under eye area. So it just gives a rejuvenated look, and it should, a good procedure is a procedure where no one is able to tell that you have undergone some procedure, and that is how it should be done. Lip filler, again very popular, but what to understand is what not to do and how a lip filler can go wrong. As I said, minimum use is the key for beautiful fillers, and that is how we use it in a minimal amount. Same nowadays, non-surgical nose procedures are very popular using fillers when there is slight amount of depression or slight bumping or slight hump. It can be very well masked using a filler. So here we have defined the bridge, nasal bridge using dermal filler. Same here, a slight amount of hump is marked with filler, and chin definition is given with filler. Filler is also used for acne scars. So what we do is we inject the fillers and we release the scar fibers first, then we inject the fillers, and over that we do carbon dioxide laser, and it gives very good results. The last in the series is deoxycholic acid. So deoxycholic acid, what it causes is it melts down the fat. It causes atrophy of the fat cells, usually used in the double chin area to reduce the bulk of the neck. These are the points how we marked. A total of 5 to 6 ml of deoxycholic can be given. So this is with the brand name Geolysis, which is available in India. And these are the results post the procedure. At least for 1 to 2 weeks, the neck looks swollen, and after that, gradual atrophy of the fat occurs, and the pulling effect can be seen. A study published by our center using the deoxycholic acid for Indian patients giving very good results. These are certain cases which we have done using a combination treatment of botulinum toxin, of fillers, and facelifting procedures, etc. So here this patient, she wanted a more rejuvenated look, more glowing skin. Also, we have combined with a couple of sessions of laser as well in this patient. This is a patient in which under eye filler has been done. There is drooping of the face, which has been very well achieved using threads. Also, slight amount of filler has been done in the chin area just to define the jawline. And that is what we have done. We have also done slight amount of botulinum toxin for the even tone of the skin. Again, a patient, she wanted a more rejuvenated look. So we have done under eye fillers, we have done some lifting procedure, etc. Moving on to the rejuvenation of hair, as we know that all the people somewhere or the other around 20-25 years onwards nowadays are suffering from a problem of hair loss. So on an estimated data, what we have achieved, 54% of the female and 68% of the male are usually facing the problem of hair loss. Lot of factors these days, genetic factors, lifestyle, hormonal imbalance, and of course stress contributing to the hair loss problems. Different procedures what we are currently seeing in India being done are topical minoxidil, then oral finasteride tablets, hair transplant surgeries, laser therapies, etc. stem cells, platelet-rich plasma, which we usually consider as a boon for hair rejuvenation, and of course retinoids and multivitamins and other tablets, etc. But what are the problems which with these things are the results are very unpredictable. There are a lot of side effects. For example, with minoxidil, a lot of people face a lot of people face increase in the heart rate, and there is itching of the scalp. There are no all these procedures except for hair transplant. All the other things, non-surgical things which we use, there are no evidence in the literature or no studies in the literature which clearly defines the efficacy of one particular procedure. And some of them are invasive. For example, hair transplant, the patient acceptability, compliance for procedures hair transplant, of course, is expensive. It's an invasive procedure. It's a costly procedure, and it's not suitable for all the candidates, and so on. Platelet-rich plasma, we know, difficult, cumbersome procedure, no standardized technique, no, there are no studies. There is no patented procedure that, yeah, this is a calibrated procedure and this is how it has to be done. Everyone is using different protocol and different technique for platelet-rich plasma, etc. So what I am going to talk here about is a solution which is which is technology available right now in India, is a QR678 Neo solution. This is a bioengineered formulation which is developed after a lot of scientific results, a lot of animal trials, a lot of human trials, and now is available in India for the use, for the pharmaceutical use. This is a plant-based product with a calibration of growth factors which are required for hair rejuvenation. The advantages are that it is very cost effective as compared to hair transplant. The results are, the success rate is too much for this product. The results are very good when compared to PRP, and it's a non-surgical procedure, and because it is plant derived, the side effects are zero. So what it contains basic fibroblast growth factor, keratinocyte growth factor, vascular endothelial growth factor, insulin-like growth factor, copper tripeptide, and thymosin B4. As I said, it's a plant-derived formulation, so the side effects are minimal. And what it causes is, basically, there are 3 stages in the follicle development: anagen, catagen, and telogen. It increases the activity, hair growth in the anagen phase, and growth factors acts on the dermal cell and start and trigger the anagen phase. That's how it increases the hair cycle and hair retention also. How it works? We have to give 5 to 8 sessions are to be done at an interval of 2 to 3 weeks. 1 ml of the solution, which is a ready-made solution, has to be taken. Vial contains 5 ml. 1 ml solution has to be taken and injected on the scalp of the patient. I have attached a video later demonstrating how to inject it. And it has to be repeated every 2 to 3 weeks for a total of 5 to 8 sessions. Result, as I said, we have done a prior animal trial which had 2 arms. In the arm 1, what we did is we, using the growth factors, we injected it on the rats, and the results, we saw the hair retention. Also, the second step, which was done was, it was a chemotherapeutic agent was injected, cytosine arbinoside. After that, there was loss of hair in that particular area, and then after that, the solution was injected, and we saw the retention of the hair after the solution being injected. All the studies, the animal trial is published in the Journal of Plastics and Reconstructive Surgery. The human trial was also done, which is published in Journal of Cosmetics and Laser Therapy. These are the results which we achieved. There is increase in the vellus hair, increase in the terminal hair, decrease in the vellus hair, and shaft diameter is increased. And we also compared QR678 with PRP, and the result for that is also published. So what we achieved is, we saw that the retention rate with QR678 is more compared to PRP. Like, what is with PRP is, First of all, we are not sure if it's because of the mesotherapy, like the procedure we are doing, because it already causes the release of growth factors, or is it because of the PRP solution that we are doing. But the retention is good till the time PRP is being used or few months after that. But the retention of QR678 is for a very long period of time. Also, the solution is close to the neutral pH, therefore the burning sensation, the itching sensation, etc. also is minimal with the use of QR678. Also, the study has been done in patients with PCOS. The study has been done with patients who has been treated with chemotherapy, etc. And it is published in the literature. The solution has got Indian and American patent. And this is how it is injected. So, PRP can also be injected using the same technique. We usually sterile the scalp first with a sterile swab, and we load it in a 1 ml syringe, and this is how we inject the solution. Very simple procedure to do. It will hardly take 5 minutes to complete the procedure. 1 ml has to be injected at one sitting. Very superficial injections are to be given. So we are also doing a study where we are using derma roller and trying to give the injection, and we'll see the results, how it comes, like if it's better with the syringe or with the derma roller. Supportive therapy, what we can give for any patient with hair loss, if you want, you can take a screenshot for this. We can give a Folly Hair tablet or hair stem tablet, which contains amino acids, mineral, vitamins, etc. Finasteride, if the patient is comfortable. We can give finasteride to the patient, which is a DHT receptor blocker. Then a Crinus hair solution can be given, which has to be applied once a day in the morning time. So it's a water-based solution and it's not oily. So this can be combined. And apart from this, lotion mint pop in the evening hours, if patient wants and is comfortable and is not facing any palpitation, etc. Lotion Candid B is given for only the patients who are facing dandruff issues, because applying other solution can aggravate the dandruff problem. So Candid B can be given. Shampoo Anaphase Plus 4 times a week, and shampoo Candid B if the patient has dandruff. So this is the usual regimen which we give to any patient with a hair loss problem. So you can start prescribing any patient, irrespective of you are starting any therapy or not, you can combine this with that. So this is how we inject it in a female patient. Just a sterile swab and we can clean. So this procedure is not very painful. That's why we are not applying any solution for a numbing cream or etc. But when we do PRP, usually numbing cream or lignocaine etc. should be applied so that there is less pain. But this is a comparatively painless procedure. So very important point which are to be kept in mind is counseling and counseling, making the patient understand about the treatments, what is good for their face, what is not good for their face, for their hair is very important. Because what happens is these patients are already looking good. Like when they're coming to your clinic, they are actually in a good state of their looks in terms of anything you say, and they want to improve it further. So it's not that if you do okay chalo kar diya, patient is happy, aisa nahi hoga. They are very they know more than you. They will see 10 things in Google and then they will come for you for consultation. And when you tell them about one product, they will start talking about the second product. So making a patient understand the procedure is very important. Take one entire session just for the counseling and just for understanding the patient's complaint and making them understand what you're going to do, etc., would be very helpful. Second step is, as I said, back to school. Understanding the basics is very important. Understanding facial anatomy is very important. All these things are very crucial for starting facial rejuvenating procedure. Planning is very important. What you have to do, a complete list of procedures you want to do should be on table before starting a procedure, because you cannot do a filler procedure and then you can go for a facelifting procedure. The heat energy will melt the filler. So in case if the lifting is required, lifting has to be done first, thread has to be done second, filler has to be done third. Understanding the steps is very important. Cosmetic rejuvenation is a journey, it's not a process. You have to tell the patients that it's not that today we have done a procedure and tomorrow the person is going to look different or it's going to look like a celebrity. It's not going to happen. Cosmetic procedure is a journey. Even if you're using Botox for masseter, it is going to take a certain amount of time. It is going to take a certain amount of sessions. All these things should be clear in front of patient beforehand. Also, if we are doing Botox for fine lines, etc., it has to be very clear that the action is going to be for a particular period of time and it will be required to be repeated, etc., so that later on you don't face all these things that, okay, you said this is going to look good and now after 6 months I'm back to square and all those things. So it's a journey which you have to take the patient through. So as I said, I would like to conclude it with that aging is a fact of life and looking your age is not. Because if some person can look beautiful at 65, as much as that they were not looking at 25, so of course it lies in the hands and in the hands of the injector, in the hands of the surgeon, that how they are going to carve it. And therefore it's very important for you to learn it first before venturing into it. Understanding the basics of the procedure is very important, because it's a very small journey from aging to anti-aging. Thank you. Before ending the presentation, I would sincerely like to thank my mentors for life, Dr. Ramakrishna Shenoy sir, for giving me this opportunity and for always being there. He's my mentor under whom I have done my post-graduation, and no less than a father for me. And Dr. Devraj Shom, my mentor with whom I have learned all the cosmetic procedures. And these two persons are very important, and I would like to sincerely and yeah, you can contact me here. Thank you so much. Over to you, Nilima ma'am.
Thank you, Sapna. That was a very nice presentation and very informative too. And shall we start with the question answer?
Sure, ma'am.
Okay. First, we'll start with Garg sir. He has appreciated your presentation a lot, and he would like to know what are the contraindications for this minimally invasive procedure in medically compromised conditions like diabetes mellitus or hypertension?
So, okay, no contraindications, because these are just the superficial procedure. We are not injecting in the blood vessels. We are just injecting in the muscles. Even if the patient has diabetes, even if the patient has hypertension, we can use these procedures very well. Any of these superficial cosmetic procedures can be used. Only we avoid using the procedures for pregnant and lactating female. Although nothing has been mentioned in literature, but that again is an indication, because nothing concrete has been mentioned in the literature of not to use it or to use it. So we better avoid it in pregnant and lactating female, but otherwise hypertensive diabetes patient, we can use it because we are just injecting in the muscles, etc., and the skin.
Okay. We'll take the next question. Dr. Satya Sai sir wants to know, can deoxycholic acid or TCA chemical peel?
Sorry, I cannot hear you.
Can deoxycholic acid or TCA chemical peel be used for treating xanthelasma of eyelids?
Actually, we are not covering peels here, but xanthelasma is because of cholesterol deposits. Until and unless we don't take the cholesterol under control, it is again going to reappear. So apart from doing any procedure, it's very important also to make the patient understand to take the cholesterol profile and also to keep bring the under normal level. What we do at our center is we remove the xanthelisma using surgical procedure, a fine surgical or cautery, etc. We don't usually use peels for that. Deoxycholic acid cannot be used because it's for fat. We don't use deoxycholic acid near the eye. It's not advisable.
Okay. There's another question that is it safe to perform local lipolysis in submental region?
Of course, lot of people fat removal is a procedure, but when we have it's kind of a minimally invasive procedure itself, removal of the fat. So it's one and the same. What we use at our center is the deoxycholic acid, and it's the latest trend. That's why I've used it here. I have mentioned it here. But of course, fat removal is itself one of the known method of fat removal in the submental area.
Right. You have spoken about gummy smile, right?
Yeah.
One of the participant wants to know how you will come to know that this is because of the skeletal problem or this is because of the muscular origin.
So as we know, semantic profile, we have to do the, if we want to go into very much detail, we can do the jaw analysis, etc., and rule out
Right.
if it's skeletal. We can see the tooth ratio, and we can find out if it's gummy, and we can see the muscle movement. And if we feel that it's more because of the muscular pulling or broad smile, etc., then maybe we can use botulinum toxin for that.
Right. And like there are many anti-aging commercial creams are available in market. What is your take on that?
There are a lot of brand-based creams available. Some would give good results. Like I don't want to name any individual cream right now. That's an entirely different section going into the pharmacological and that aspect. But yeah, creams can be used. But you know, it's like to a certain level they would give results. Like for example, if you talk about not a good comparison, but for example, scaling would give a result to a certain extent in brightening of the teeth, and bleaching would give a result to a different extent. So similar to that, a cream would work to a certain extent because it would just work on the superficial layer of the skin. But what is the cause of aging lies much more deeper, because you know there is fat atrophy, there is loss of the three-dimensional collagen structure, and here what we are talking about anti-aging is restoring what is beneath the skin. So creams would work on the superficial layer very good, but to restore the volume, restore the structure, we need certain procedures.
Right. Okay. One of the participants wants to know, can Botox be used for chin area?
Yeah, of course. When there is a cobbled appearance of the chin, hyperactive mentalis action is there. We can use 10 to 15 units of Botox for the chin, but we have to be very careful not to use too much of Botox. We have to be very careful not to use Botox at the attachment of mental muscle, where the muscle attaches, because it may lead to chin ptosis. That's why it has to be used in very minimal quantity, calibrated manner.
Okay. Another question is, we have discussed that to reduce the face bulk, we can inject botulinum toxin in the masseter area. Okay. So does it interfere with the chewing?
What study we have done, what I have come across, the literature says that the bulk of masseter and the strength of masseter is approximately 8 times of the maximum amount which is required by a human tooth for biting the hardest substance. This bulk, the strength is approximately 8 times to that. So even when we reduce it by 40 to 50%, then also it doesn't affect the chewing efficiency at all. And we have not literally experienced this in any of our patients also.
Okay. What will happen if filler goes wrong? Then what can be done?
Okay, so as I mentioned, hyaluronidase we can use commercially, very well available in the market. Any medical shop, it is easily available. We also use it for different purpose in oral and maxillofacial surgery. So hyaluronidase is mixed with 1 ml of saline. It is injected, and then in a bottle it will come 100 units, and then we inject 1 ml of saline in that, and we withdraw 0.1 ml. Again, mix it with 0.9 ml of saline. That's how we dilute it. So we want a very small amount of hyaluronidase, and we inject wherever we feel that filler is in excess, or maybe we have got a Tyndall effect due to filler, because if by chance filler has gone into the blood vessel, etc., what we can do is we can inject hyaluronidase there, and immediately you will see the result. Immediately you will see that the filler is dissolving. So it's a very simple procedure what we can do if the filler goes wrong.
Okay. You have very well explained about the QR678, the new technique in hair rejuvenation. So
Yeah.
can you please let the participant know where it is available, how it can be procured?
So it's a patented technology by the aesthetic clinics, and now it's commercially available in the market. So if anyone in case wants to procure it or wants to get it, can get in touch with me, and I will let them know where they can find the product and how they can get it in their clinic.
Okay. What do you think? What is the importance of consent when in cosmetic surgeries or any of the cosmetic procedure?
Yeah. So the thing is now, as I said, these patients are so much literate who are coming for a cosmetic procedure. They are so much aware about everything. So high chances of getting into a medical legal thing with a very educated patient who thinks that they know a lot about what they want to undergo and how they want it, how specifically they want it. They would not think twice before commenting anything about one slight thing going wrong below their eye or something like that. So, taking consent for every procedure, before Botox, before fillers, subsequently maintaining pre and post operative pictures, and one very important thing which we follow at our center is a video consenting format. So while we are going to start the procedure, we take a video consent that we are going to do this procedure. These are the side effects of the procedure. This is the success rate of the procedure. Are you willing to undergo the procedure? And if they say yes, then we proceed, and we record it in a video file also. So all these things are getting very important day by day, and therefore maintaining a consent before every procedure is extremely important.
Okay. Can derma roller of 0.5 mm be effective to regenerate hair in male pattern baldness?
So yeah, so this is a very gray area, because a lot of people say that even if we are using PRP, it's not the PRP which is causing the hair rejuvenation. It is the injection prick which we are giving. It causes the hair rejuvenation. And because it releases the growth factors which are there in the deeper layer, etc., etc. The same goes with derma roller. There are studies in the literature which suggest that it increases the blood circulation. Blood circulation would bring growth factors with them, and subsequently it would help in treating the hair fall and male pattern baldness. So yeah, I mean, there are 2-3 school of thoughts on that. So I feel that a person, if wants, can try and see if they are getting good results with derma roller. They can subsequently use it in their patients.
Rightly said. Since many people are very much conscious right now, what your take in acne scar treatment?
Yeah. So what we follow at our center for the treatment of acne scar is, so scars are basically when the epidermis gets pulled in the dermis. Acne scar, there is a fibrosis between the epidermal and the dermal layer. What we do is we take a fine needle and we break the fibers. The procedure is called as subcision. If you can see subcision, you'll be able to find a video of how it is done. It is a very clinic based procedure, very minimally invasive procedure. We break all the fibers of all the acne scars. So there is the gap which is created between the epidermis and the dermis. Now what we do is we inject the filler in the gap which we have created, because even if we want something to work from outside, we want the layer in the superficial area to be symmetrical. If it is pulled down, nothing would be able to work on the superficial layer nicely, be it peel or be it laser or anything. So first we have to pull up the scar. That's why we break the fibers, we inject the fillers in between, and once this has settled down and the layer has been lifted a little bit, then we do the carbon dioxide laser over it. So couple of sessions, depending on how much is the acne scar, how bad are the scars, we do the carbon dioxide laser, and then it gives very good results. So this is the protocol what we follow at our place.
Okay. One last question is there. Can we use Botox in reducing scars specifically after suture?
No, Botox is not usually used to reduce the scar. Botox won't give any result for the scar. When I said that it's used for scar revision, is because when we are undergoing a scar revision surgery, after the scar revision is done, there are chances that the scar may again be pulled. To reduce that pulling effect, we relax the muscles around the scar using Botox. But it has no use of itself in the healing of the scar or the removing of the mark of the scar. For that, we need procedures like laser, etc.
Right.
Nilima,
Yes, sir. Sir, questions are done from my side.
just one.
It was very well explained, Dr. Sapna.
Thank you so much, ma'am. Thank you.
There's one question from Shruti.
Okay.
How to prevent fibrosis in mucosal region after any surgical procedure?
Mucosal reason.
Yeah. Fibrosis.
Intraoral.
Yeah, is that what Shruti you're asking? You can ask the question directly.
Yes, sir, it's intraoral. Intraorally, if there's fibrosis, how can we prevent that after any
Like,
surgical
are you
procedure?
talking immediately after the procedure, or you're talking
Yes,
after a
yes.
couple of weeks?
See, it's immediately after a procedure, like when we take a vestibular incision for maybe say plating, just after 2 or 3 days, we see there is fibrosis. So, is there anything we can do about it?
I don't think so, because when we are doing a procedure and when we have given us sutures, we should not disturb it for a certain period of time. And we should not hamper the healing while it's being done. Once we have removed the suture, also after that, for a couple of weeks, there is skin remodeling, the tissue remodeling is there. So I don't think there is any need to be worried about the fibrosis on the immediate basis. Later on, maybe you can give something to for the massage, etc., which can reduce the fibrosis a little bit. But immediately, I don't think anything has to be done and disturbed. We should not disturb that area.
And if we counter that later on, as in after maybe say 20 days or 20.
Also after that, I think 1.5 month healing would be going on. So I don't think it has to be disturbed. And later on, maybe we can give Gumex, etc., for massage, because I have personally seen that with Gumex, if we ask patient to massage it using finger and thumb, it dissolves the fibrosis very well. This is what I have personally experienced. Like basic
Okay.
be done first before jumping into the advanced things.
Okay, thank you, ma'am.
Sapna, there's an interesting question. This is not pertaining to the procedure, but this is Swati Priya who wants to ask on how to proceed in the field of facial aesthetics at MDS and OMFS. Currently, I don't think our curriculum supports it to a great extent. We've been fighting the AMSI has been fighting a lot of cases on this particular thing. But yes, I'm sure you can get in touch with experts like Sapna, and they will definitely guide you in whatever you wish to do.
Yeah, definitely you can get in touch with me. I think on a usual basis, on an average, I get 5 to 6 calls every month for this thing. How to get into this?
You can start your own academy then.
Yeah.
I am thinking I'll take one presentation specifically to how to get into facial cosmetics.
Yeah.
Swati, can you unmute yourself and ask the question?
Hello, sir.
You have another question, so can you just go ahead?
Yes, sir. Sir, I wanted to know what are the different approaches for the suspension thread lifts for the different areas, like for the eyebrows or the malar region, and how much weight can it hold on to?
So as I said, using thread comes with a lot of experience, because a lot of surgeons say that thread don't work. I feel the thread won't work if it's not done by a good surgeon. I feel so. Thread is a very simple procedure, but a very critical procedure. What happens is, at times when we use threads in the forehead area, then the thread is very much visible like a vein here. So understanding what is the bulk and how to use a thread, how to put a thread, and that is very crucial. Like we cannot define कि इतना force hold करेगा ये वाला thread. It's not how it works, because you can use 3 to 4 threads in that particular area if one single thread is not working like that. So I think that will come with experience. When you see certain patients, when you handle certain cases, then only you can get a heck of it. It's just like doing extractions. You learn it over the period of time.
Okay, ma'am. Thank you.
Yeah, Sapna, I think we'll wind it up now.
Sure, sir.
Sir, one question from my side.
Yeah, Brinda, please go ahead.
Yeah. Sapna, wonderful presentation, very elaborate. Just a query in my mind. You said systemic diseases doesn't as much interfere with these procedures. Do you have any experience with the patients on anticoagulants and blood thinners?
What is the
particularly thread lifts and toxins? We are going into deeper planes.
What we have to do, we usually avoid, don't do any profile, or of course we ask for the systemic history from the patient. If the patient is on anticoagulant, etc., we may ask them to stop for a day or two if that is not very mandatory, what we are doing based on the consultation with their physician, etc. But the bleeding also is very minimal in such patients, less than even an extraction procedure. If the thread is properly done, and if we have pressed it for like 2 minutes, there won't be any bleeding at all. So all these steps, if we be very careful of, then I don't think we have to worry about anything. If there is slight amount of bruising may be noted in some patients who are on anticoagulant, etc., then we can give them local ointments like thromboform, and the bruising would be dissolved in 2 to 3 days. But because and with Botox and fillers, there is no bleeding at all if done rightly. Fillers, at times, if we prick into the blood vessel, there would be slight amount of oozing, which would be stopped with a clear pressure. So I don't think these are the procedure which we should worry about, because extraction would cause more bleeding than these procedures.
Right. Okay. Thank you, Sapna. Over to you, sir.
Yeah. Thank you, Sapna. Thank you, Nilima.
Thank you.
Can you stop sharing?
Thank you, sir.
Sapna, can you stop sharing your screen?
Yes, sure, sir. Sure.
So it was a wonderful talk, Sapna. I mean, you've done us real proud by doing such great work. And I'm sure you've inspired a lot of youngsters to get into this field, because after all, the face belongs to us also, more than anyone else. So you've done great job. Congratulations. And now it is, I'm duty bound to honor you with a certificate for gracing our platform. So thank you, Sapna.
Thank you, sir. The pleasure is all mine.
Yeah, this is for you. It was long due that we had you speak on a platform of the college and the CIMS. So thank you. Dr. Rahul Chajlani from Indore has complimented you on your talk. So that's wonderful. Nilima, thank you so much. And we will be sending you these certificates. Nilima can collect it from here. And Sapna, it will be sent it over, of course, through email or WhatsApp, right? And give our thoughts to everyone. And God bless you all. Thank you, people, for joining once again. And I'm sure we are going to take it further in the month of November. So stay tuned. We had lost a bit of our touch since it was nearly 2 months since we did a webinar. So thank you for joining in good numbers and encouraging us. Thank you so much. And big congratulations to all those who cleared. Many of our just recently passed out PGs were there: Nilima, Shruti, then Urvashi, Harsha, Satyasai, Monica, and I could get few names. Pardon me if I don't know the others. So thank you so much.
Thank you.
Thank you, sir.
Okay. So it's there on Facebook, and we'll see you soon. Thank you. Bye-bye.